The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Sorry for the delay. My name is Todd McDonald. I'm the president of Aisling Partners Insurance Brokerage here in Worcester, Massachusetts. And I'm joined by my business partner, John Clark, as well as our staff here at our firm. In addition, we're joined by our sister company in Glastonbury, Connecticut, Catalyst Benefits Consulting, which is led by John Fitt. So on behalf of us and all of us, we thank you for participating this morning. Before we get started, just a couple of housekeeping items. If you could mute your telephone and computer microphones as they tend to cause some feedback. Also, just want to remind everyone there's a couple of different ways to pose questions. You can certainly type your question in the white box at the bottom of the chat box. There should be a to box for which you can select two presenters and then hit the button and the arrow and it will post your question, or you can simply wait till the end of the webinar and ask your question then. And then finally, the takeaways for this session and others can be downloaded under our website of Aisling University. As you are all aware, this morning we're reviewing the topic of FMLA, and more specifically, we'll be addressing reasons and drivers to outsourcing leave administration, costs associated with remaining compliant, as well as factors associated with the FMLA law. The goal of the course this morning is to provide employers with a better understanding of the laws surrounding FMLA and the best practices for remaining compliant at both the state and federal level. As many of you know, we are not, the information we try and provide is independent, but at times we certainly choose some of our vendor partners who we feel have the best information and education available on a particular topic, and this morning is no different in choosing Tim Suchecki from Reliance Standard, who is the national practice leader. Tim Suchecki is that leader for Reliance Life Insurance Company, as well as First Reliance Insurance Company and Matrix Absent Management, Inc. He is responsible for sales production and persistency among Reliance Standard's national account clients who employ integrated programs of disability and various enhanced services through RSL's sister company, which is Matrix Absent Management, Inc. Mr. Suchecki oversees a team of national practice leaders who work with Reliance Standard's sales force to identify and meet the sophisticated productivity management needs of the nation's large employers. In his current role, Mr. Suchecki has been a driver in the development of RSL's health and productivity management strategy, including Reliance One, a strategic health and productivity management initiative delivered in tandem with a company with Deveray. So it is my pleasure this morning to introduce Tim Suchecki from Reliance Standard. Tim, do we have you on the phone? Bear with us a moment. I think Tim's having some technical difficulties.
Okay. Good morning, everyone. And Todd, I'm assuming you can hear me now?
Oh, we have you.
Yes, Dan.
Okay, great. Good morning, everyone. I'm happy to be here. Thank you for that introduction. I'm assuming that we all can see the screen, and I'll proceed forward. My objective this morning is to, as Todd pointed out, give you a high-level overview of the FMLA laws themselves, but also to help stimulate ideas on how one might feel different about the FMLA laws and what the alternatives are within the state and federal guidelines. You were sent out a self-assessment tool, and it was really just a tool to have you think about how you manage your programs and what alternatives there might be as we walk through the presentation as a whole. My agenda will be to first talk about some trends and statistics that we see both from facts from the Department of Labor or industry conferences or non-research or research facilities like Integrated Benefits Institute. Also to talk to you about employer challenges, your peer employers and what they may be struggling with. The key elements of the law itself, who's eligible, the tracking requirements, the medical certification process, and then also equally as important, the employee compliance aspect of it. and then importantly to talk about what you as an employer might be able to do to help build a business case for alternatives. Alternatives might be in additional human capital, it might be changing employer policies, and it might be thinking more broadly about considering outsourcing. But what the best practices are, and these best practices are defined by the Disability Management Employer Coalition for employers and FMLA administration. Just real quickly, when employers are surveyed, more than 50% of employers are offering FMLA job protection to those employees that are not eligible, whether it be they've exhausted the benefits or they didn't meet the minimum qualifications, which we'll talk about moving forward here. 75% of the employers struggle with intermittent FMLA. Most people are not aware that the average cost of litigation, and this is one FMLA claim on a national basis to be litigated last year, was $78,000 on average. And then typically at the Department of Labor, 60% of the awards for our actions at the Department of Labor are awarded in the employee's favor and can range anywhere from the high 80s to almost $500,000 in claims against the employer. Again, the Department of Labor and the Integrated Benefits Institute have outlined most employers struggle with the tracking of FMLA. In our experiences at Reliance Standard, more than 95% of the programs that we help clients outsource are coming from an environment where they've homegrown or built their own technology solutions to administer FMLA in the state and federal guideline requirements. So a big struggle for employers. Most employers are thinking about doing something different around FMLA because of the serious health conditions and employers not wanting to be directly involved in the medical certification process and also communicating with the medical providers. Things are not getting any easier. The regulatory outlook is that FMLA, both state and federal, are going to get more complicated. The administration is looking at broader benefits. They've recently increased the military leave benefits. There are more states that are thinking about paid benefits. There are now municipalities across the country that have FMLA job protection. If you're an employer doing business in particular cities, your employees are entitled to job protected time off for that criteria that municipality offers. So getting more and more complicated, not necessarily easier. What we see as the complications for employers mostly is the administration around FMLA. The lack of a system or a technology solution, how to stay up to date on the federal and state requirements, and then also dealing with the abuses associated with FMLA administration. The majority of employees are filing claims. They're entitled to the job protection, but there are, in many areas, employees that take advantage of the system and are highly educated on FMLA and FMLA job protection. As well as, at the end of the day, the productivity aspect of it. Having people out of work, whether they're eligible for it or ineligible for it, and the impact on productivity from an employer standpoint, the direct hard dollar cost or indirect costs associated with FMLA administration. Just real quickly on the law itself, the law itself is not a complicated law. It's difficult to administer. When the law came into effect, the intent of the government was if I didn't have an employee distracted by home and life issues, I'd have a more productive workforce. The minimum requirements of the law are to ensure job protection for a fixed period of time, ensure healthcare continuation, and to minimize discrimination between the employee population. So they're the key drivers of the intent of the law. And now I'll walk through elements of eligibility, the medical certification process, and then the communication processes, both employer required and employee compliance. For employers, the minimum eligibility for an employee is in the previous 12 months, has the employee worked for the employer for 12 months. That 12 months does not have to be consecutive. It could be within a gap year or a fixed gap session of 7 years. Up until 2 years ago, that 12 months was not capped. So it could be in greater than 7 years, an employer would have to look back to figure out if an employee hit the 12 months. And then in the previous 12, has the employee worked for 1250 hours? It's also 50 people in a 75-mile radius. That 75-mile radius is through available transportation. In our experiences, for the mid to large employers, 98% of our clients are waiving that 50 employee in a 75-mile radius. Part of the driver to that is that employers find it equally as important to offer the consistent benefits across all employee populations. You'll note that 1250 hours in the previous 12 isn't a full-time employment, so in a 52-week period, it could be somebody working part-time or working an average of 24 hours a week. So for our partners or employer partners in the marketplace that have a high retail population or work in the retail or have a high part-time population, they're benefits eligible employees and then FMLA eligible employees. In that 50 people in a 75-mile radius, there are employees that do not have a fixed work state or a work site, someone that might be a salesperson and works out of their house. You would look to where they're directed and paid out of, and if from that office there were 50 employees in a 75-mile radius, then that employee would be usurped into that particular location and given that job protection for FMLA, both federal and state. The 10% highest paid in a 75-mile radius, again, this is another feature that most employers waive, but if you have a small location where the top 10% wage earners are key personnel, having them being gone or keeping their job available beyond 12 weeks is a hardship. You have to communicate that to that employee that they would not be entitled to their same job and same stature when they return. The health benefits requirement. An employee's eligible to maintain health insurance at a minimum for their 12 weeks of job protection for federal. They're also entitled to any other benefits that might be continued for some other time away from work provided by the employer. So a disability program, for example, if the employee is eligible for continuation of life insurance, dental, vision, any of those benefits that are provided under a non-FMLA time of work, the employee is eligible to continue those in addition to the health care. The employee is required, of course, to pay their portion of the premium during that period of time. This tends to be a big struggle for employers. The challenge is the administration associated with the collection of those premiums. Obviously, many employers will, because of that complication, collect those premiums when the employee returns. It is completely legal to do that. The complication is magnified when an employee is out for a fixed period of time. They continue the health care benefits and then elect not to return back to work, so they've been awarded that those health care benefits for a fixed period of time without paying their fair share of the premium benefits. The job protection is for that 12 weeks, and admittedly, some other states have broader variability. There are 34 states that now have FMLA job protection as well. Many states have extended that 12 weeks to 14 or 16 weeks in a 12-month period of time or a 24-month period of time. So you need to think about the federal laws and the state laws, but the employees protected for their same or equivalent job with pay, job responsibilities, skill sets, and seniority. The FMLA does not protect against layoffs or workforce reductions. So if an employee is scheduled to go out on an FMLA claim or is in fact out on an FMLA claim, and there is a future layoff or a layoff during that FMLA extended period of time, the employee is only protected through the point where that layoff or workforce reduction would have occurred. FMLA does not protect against those. FMLA is only the ability to recover your job within the contract as well. So if you're a contract employee and you would have 6 weeks left on your contract and you request FMLA job protection for 12 weeks, you're only entitled to the duration or the termination of your contract itself. From an FMLA, it is protection of a job, it's protection of healthcare benefits, and it is something that is defined as an unpaid job protected benefit, although often it runs concurrently with a paid benefit. Generally, in our experiences, about 75 to 80% of FMLA claims are disability claims, and often those disability claims and or work comp claims are paid benefits. So they are running concurrently and should be running concurrently with the FMLA job protection and paid benefits. For the non-disability related or work comp loss time related, the employer can elect to have the employee use PTO or earned time and have the employee use that as an option to use all or some of, or the employer can require that the employee use a PTO, earned time, or vacation time against their unpaid FMLA. The idea is, in this scenario, to not, in terms of gold standards, to not have the employee have the ability to stack benefits. For an employee takes 12 weeks of job protection and then has 30, 60, 90 days of banked time, paid vacation time or PTO, that they can stack on top of that. The intent in a gold standard of best practices environment is to require that the employee use some or all of their earned time or PTO time against an unpaid FMLA benefit. It's important to note, not unlike most of the features that are in the FMLA law, you need to continue to review your employer leave policies to ensure that all of this information is documented within your employer policies. if it's not documented, and I'll point out other elements throughout the presentation here, if it is not documented, then the employee has the right to elect whatever feature would be to their best interest. So who's eligible, what employers are have eligible employees, and now from a tracking standpoint, how do we track FMLA? There are 4 primary tracking methods. Some are more preferential than others. The calendar year, the 12-month or anniversary year, rolling forward and rolling backward. The majority of our clients are on a rolling backward, although a few are on a rolling forward. The calendar year and the anniversary year are the least attractive from an employer standpoint, although the easiest to administer. They're the least attractive because an employee can stack time. Again, the intent is to have the federal and or states have a fixed period of job protection within a 12-month period of time. If you're on a calendar year, you're able to stack up the end of, let's say, November, December of 2012 and stack up January, February of 2013 and be out for a minimum, depending on where you are, of 24 weeks continuously rather than a fixed period of 12 weeks that you would not be able to stack up in a rolling backward or a rolling forward. The only exception to that, which is a new feature or newer feature to the FMLA law itself, is the military caregiver leave. And military caregiver leave is for 26 weeks, and it's required to be counted as a rolling forward. So you might be an employer that has a rolling backward tracking mechanism, which we think is a good mechanism. But if you have anybody on a military caregiver status, you have to track moving forward. And then complicate that by most of the time employers are tracking on Excel spreadsheets and don't have a system. It lends to administrative difficulties and equally as important, not being in compliance with the federal and or state FMLA requirements, whatever state you're doing business in. So that's the tracking aspect of it. And now obviously there are 2 types to track. The continuous, and that's 4 calendar days, which could also be a Friday, Saturday, Sunday, and the Monday would be that 5th consecutive day. And then intermittent time. Intermittent time does not have to have a fixed period of lost time. It could be a reduction in work due to one's serious health condition or a family member's serious health condition. When you're tracking intermittent time as well, intermittent time is based on the hours worked. So obviously 480 hours of intermittent time in a 12-week period of time. If you're a 40-hour work week, you might have somebody that works 32 hours a week on average. Looking back in the previous 12 months, they're only entitled to 384 hours of intermittent time in a rolling 12, if that's how you calculate, and not the 480, or obviously the higher alternative is if somebody averages 50 hours a week because of overtime, they're entitled to 600 intermittent hours from a tracking standpoint. So the tracking mechanisms, the tracking methods, the continuous and intermittent, and now from an employer obligation standpoint, what do I have to communicate to the employees? When do I have to communicate that with regard to the federal law? There are, regardless of the size of an employer, you have an obligation to communicate to new hires or have a written handbook or policy with FMLA information in it. Obviously, not surprising, if you have a high population of non-English speaking employees, that high population, maybe a 40% Spanish speaking population, you have to have the communications in that Spanish language. You can also have the handbook in an electronic method, but you have to be able to demonstrate that all employees have access to that handbook or some written communication associated with FMLA. Again, it's important to communicate or review your policies as a whole. The fact that FMLA might run continuous with disability and or work comp, if you don't communicate that, it could allow the employee to revert back to the alternative that they would prefer, that your benefits and or a job might be terminated after a fixed period of time. That is important to communicate, although most employers, because of the new ADAAA, are thinking differently about having that hard line, black and white, at the end of 12 weeks, we terminate employment and or health care. And the employers obligated by law to review what would be considered the reasonableness when somebody has an FMLA claim for a serious health condition for themselves. The employer is obligated not only to preemptively communicate what the employee's eligibility is for FMLA in the leave policies, new hire manuals, new hire communications, but the employer's also got a whole series of information that's required by the federal law to communicate to the employees. In our administrative process, there are upwards of 15 or more different letters that could potentially go out to communicate and a fixed period of time the employee's rights and obligations and or rights and responsibilities. The eligibility notice needs to go out within 5 days, and that it's 5 days from the employee communicating that they're filing an FMLA claim, or when an employer acquires knowledge that would lend them to believe that their time away from work, their being the employee, would be FMLA job protected or could be FMLA job protected, and then the employer needs to send out this eligibility notice. The eligibility notices need to have, at a minimum, the rights and responsibilities in detail in those eligibility notices, again, that need to go out in 5 days. What the employee needs to do to perfect that medical or serious health condition for themselves or a family member, their obligations under their continuation of premium benefits, and what they need to do for job restoration or to come back to the same job or an equivalent job. Once the eligibility is determined and a claim is medically certified, there is a designation as well. That designation needs to communicate to the employee the time that's available. Somebody may have exhausted some time, so of the 12 weeks, you have 4.8 weeks left for your requested FMLA job protection. You're approved for 4.8, you've requested 6, the difference is not approved. That sort of designation needs to be communicated. Now, what is a qualifying event for FMLA, and who is qualified for that qualifying event? The FMLA is for serious health conditions. We'll talk to you about what is considered a family member. It's the employee's own serious health condition. It's for care of a child, for birth, adoption, or foster care. It's for care of a spouse or a parent. and then the deployment of somebody for active duty military. Serious health condition definitions: inpatient care plus incapacity and treatment. And you'll note that the threshold for most often employers that have a disability or salary continuance plan, the threshold for FMLA qualification is much more liberal than typically an SPD or a plan design or a policy would be for disability. The requirements are much less stringent. The inpatient care plus incapacity and treatment, more than 3 consecutive days, as we've previously talked about. So it's on that 4th day, that's job protected. Pregnancy or prenatal care, chronic conditions, the ever popular migraines and or asthma as chronic conditions. Permanent or long-term conditions might be strokes or Alzheimer's. And then multiple treatments. Multiple treatments might be something like a physical therapy or chemotherapy, either scheduled or unscheduled, but multiple defined treatments. So those are the serious health conditions. And now we'll talk about the family members themselves. It is for the spouse, the husband and or wife, defined. The federal government does not include same-sex domestic partners because of the Defense of Marriage Act, but some states may include same-sex domestic partners. So you need to look at the state laws, if there is a state FMLA law, and then under the federal laws of what's constituting a marriage and or a common law marriage. Parents as a family member, so it's not a parent-in-law. I can't take time off to take care of my mother-in-law's serious health condition, but the definition of parent has changed because of loco parentis and then the interpretation of loco parentis into the definition of a parent and or child for FMLA. Loco parentis is at the end of the day, if you are an adult who is responsible for the physical and or financial care of a minor, or the alternative, if you are a minor who was physically cared for and financially cared for an adult, they could be considered your parent, or you could be considered their child if you meet those minimum qualifications. The claim for loco parentis is simply the employee's assertion to meet those 2 standards. And then the next of kin. The next of kin is only specific to military caregiver and only used for that certain federal FMLA condition. The military caregiver is for 26 weeks. Next of kin can be your nearest blood relative or anybody that you as a military service person defines as your next of kin status. So it does not necessarily have to be your nearest blood relative. A service member can have multiple people that qualify for next of kin status for one military caregiver issue. So if somebody's injured in active military duty, you could have a husband and wife who work for the same company, and both of those employees are eligible for military caregiver status for that particular employee or for that particular service member. So we've talked about sort of who's eligible as an employee. We've talked about the employers that have eligible employees. We've talked about the complications with regard to communication and tracking of FMLA and now what constitutes a serious health condition and who might be eligible for the status of a serious health condition within your family structure. From a provider communication standpoint, how do I as an employer verify that it's a serious health condition, whether it's for the employee or member or for a family member? It used to be that no one at the employer level could communicate with a medical provider and ask detailed questions about that FMLA requested job protection. It now is that the only person at an employer that cannot contact a doctor with regard to an FMLA claim is the employee's direct supervisor. The employee's direct supervisor is the only one that can't ask, but an employer can only contact a medical provider for the clarification of medical facts. You can't require that a doctor, for example, give you a diagnosis if you want a diagnosis. The law doesn't require that the doctor provide that, and therefore you can't require that in order to make the employee eligible. The types of treatment, you can't require that. The provider can elect to give you that, but that wouldn't be considered a clarification of medical facts in order to perfect the FMLA claim. The other, and probably the thing that I think a lot of employers struggle with the most, is the ongoing medical certification process. What's the initial and ongoing opportunity for me to medically certify a claim? The employer can only certify a claim at the end of the exhaustion of a continuous claim or every 6 months. The intermittent claim can be certified every 6 months or at a 12-month period of time. For both of those, if the medical facts change, then it gives you an opportunity to go back and talk to the medical provider. So, for example, on an intermittent claim, if you've got somebody that's been approved for 3 months of intermittent time for migraines, and the provider estimated that every 14 days the employee might have 8 hours of migraines within that 3-month period of time, which frankly is a little bit extensive, but for illustrative purposes, if the employee has more than that in a successive period of time, that might be a circumstance where the medical facts have changed, and while you've approved that claim initially for 3 months, you can go back because of those medical fact changes and re-clarify or recertify that claim with that medical provider. And now looking at employee compliance. The employee is responsible for filing a claim in the usual and customary way. This is another one of those elements that from an employer standpoint, you're going to want to document how an employee files for an FMLA claim within your leave policies. What are they required to do? Prior to some legislative updates a few years ago, it was more the burden of the employer to determine that time away from work could have been FMLA related, and the employer needed to protect themselves by filing those eligibility notices to the employee within that fixed period of time. And back then it was within 2 days, not 5 days that we have right now. The employer can require now that the employee follow the usual and customary ways to file time away from work, like if you were filing a sick day or a disability claim. Whatever that standard process is, you can make that the standard FMLA process as well. And the employee needs to file that, follow those procedures. The employee also needs to tell the employer enough information that would allow the employee to determine if the time requested would qualify or could qualify for FMLA job protection. It's not just calling in sick and considering that a sufficient notice. And the employer now, which they didn't have prior to the legislative updates, has the ability to ask detailed questions that would allow them to determine if it could be FMLA related, and equally as important, what qualified event that the employee's requesting against. And I'll clarify that. Often what we see is with heavy consumers of FMLA job protection, people that have intermittent claims often have multiple qualified events, and employers tend to just aggregate all the time against the John Doe's intermittent FMLA, as opposed to John Doe might have a child that has asthma and intermittent time associated with that from a particular doctor. He himself has migraines, and his wife is unfortunately going through chemotherapy. Each one of those has its own fixed medical pre-approved time and requested, and it's different. So in order to clarify and track, you need to be able to ask the employee, what is this time against, so that you can pattern where the medical facts may have changed or look for outliers. Is the employee consistently, for all three of these qualified events, taking Friday afternoons off? So the employee has to follow the usual and customary ways, and the employer is allowed to ask clarifying questions in order to determine, does it meet FMLA job requirements or FMLA protection, and what qualified event must it go against or could it go against? For employers, there are some high-level drivers that, as you think about a best practices FMLA environment, you want to think about these elements for increased utilization. From an employee standpoint, general dissatisfaction with a job or jobs, education on their rights from a union environment, and then loosely managed programs. Those programs that employees are known to get FMLA job protection when they may not have been qualified, or programs where employers are administering where they're getting beyond the state and federal requirements for a variety of reasons because of the liberal management of the programs. Those increase the numbers of claims that you're going to have, and also directly affects not only your need to job protect, but the productivity of you as an employer in having employees out for or unwarranted FMLA job protection. From an employer standpoint, it's liberal or rich benefit designs. There are many employers will give the employees from an FMLA standpoint what they're entitled to for state and federal, no more and no less. And that's what the federal and state laws require that you do. We have some employers that will provide richer benefits, and as long as you provide them consistently, you're legally able to give the employees more benefits, but not less benefits than the state or federal government would entitle you to do. We have a client that for maternity claims doesn't run them concurrently, them being the paid time off and the FMLA time off of 12 weeks. They don't run them concurrently, they run them consecutively. So the employee is entitled to a fixed period of paid benefits, whether it be 6 or 8 weeks, however their plan goes, and then they're entitled to 12 weeks on top of that for FMLA job protection. We wouldn't constitute that as a best practice, but it is legally eligible to do as long as you do it consistently. And then there are other drivers to it where there's increased utilization. If your state has a state law, you'll tend to have higher FMLA utilization. And then if there are paid benefits, paid FMLA like in New Jersey or California, there's a higher utilization or a trend towards utilization. So we've talked about sort of the drivers, the technology driver, the communication struggles, the tracking aspect of it, and the medical certification process. The reasons that employers struggle or find FMLA administration meeting the state and federal laws complicated. It is the inability to be consistent in your administration, whether you do it in a centralized location or, as most employers of a certain size do it, in a decentralized environment. It's how do I stay in compliance with the state and federal laws, the administration associated with it, the lack of a tool itself to administer, and then the general productivity aspect of it, having people out of work that wouldn't otherwise, in a more liberal environment or less liberal environment, be out of work. The cost of the litigation itself, and then these are some productivity numbers. These are specific to 3 clients within our portfolio, and moving these 3 clients of a decent size, but these 3 clients from a completely unmanaged environment to a more managed environment, and what the effect on productivity was. And just in the bottom client here, a 5,000 life employer in a 12-month period of time, they had 1,300 FMLA requests. A number of them were not approved at all, and a number of them were not approved for part of the time requested, and that resulted in an 18,000-hour productivity savings, where in moving from an unmanaged to a more managed environment, you have people at work 18,000 hours more than you would have in an otherwise unmanaged program. So the drivers to it, obviously, it being doing something different or thinking about FMLA administration in a different way, the lack of consistency or the need for consistency, the compliance with the state and federal laws and your own employer leave policies, the need for a technology platform that allows me to track in that way, and then the ability to stay up to date on state and federal laws at a minimum. The leave administration options are obviously do nothing, because your self-assessment lends you to believe that you answered yes to the majority of those questions, and therefore you're probably much more in compliant and running a much more managed program than your peers. Move to as is with some best practices reviews, and we'll talk about what some of those best practice reviews might be. It might be for some of you an investment in human capital, whether it be administrative support or legal support in complicated FMLA claims, investment in technology, all the way through outsourcing or some hybrid model of a combination of each of those. What I'm going to walk through right now are what the Disability Management Employer Coalition, the DMEC, believes, based on their employer groups on a national basis, surveys, and research, what would be construed as 8 industry best practices. The first and probably best opportunity for all employers is to review and update your leave policies to make sure that they're accurate and thorough. The law does allow you to control some aspect of the employee behavior and who's eligible if you document it properly and what they're eligible for. Like, as we mentioned, you have to run, you're required to use a fixed amount of paid time off. You have to communicate that, whatever that is, if that's a policy for you. How the employee files a claim, the usual and customary way, those need to be documented. The develop lease policies which apply uniformly across all organizations. If you're an organization of a particular size or have grown through mergers and acquisitions, The objective would be to have one consistent policy for the administration of FMLA. It reduces training needs and increases accuracy at the employer, at the supervisor manager level as well. If you're not centralized already, centralize the approach to FMLA administration. It takes away the variability. In location A, we have one person doing it. Location B, we have another person doing it. In location B is everything's to the letter of the law. Location A, we're a little bit more liberal because we like a certain number of employees. That disparity creates the potential for a class action suit from an FMLA standpoint. Establish relationships between HR and risk management. That again is the consistency of application. You get the work comp lost time tracked so that you're capturing all of the opportunities, and you also have a broader management knowledge of FMLA obligations from an employer standpoint. Consider a technology solution which might have the state and or federal laws built into it. And then set some metrics so you can track against. Obviously, data is power. So centralize to the degree that you can, review your leave policies, think about a technology solution, and be consistent in the training and education of the seniors or management within your organization. That will allow you to be much more consistent in the way you administer FMLA, takes away the training needs, and provides for that, making sure that you're capturing all FMLA claims. So for you, those of you as employers that have looked at this self-assessment tool, if you've got 8 out of the 12 where you're able to answer yes, you're probably in a more managed environment than our experiences are, your peers are. If you're not, then our suggestion is you talk to your producer here, and at a minimum look at your leave policies and the way the policies are documented. If not, think about what your broader options are in terms of FMLA and the FMLA options for management. And with that, I'm going to hand it back to Todd and Brooke and John. And Todd?
Can you hear me? We had just one question I just wanted to read out, if that's possible, Tim.
Yes, please.
Okay. The question being was from one of our clients that said, what if an employee goes out on STD and FMLA information is sent to the employee, but that employee does not return paperwork or wish to take the FMLA leave? Is it the employer's responsibility to collect the FMLA paperwork anyway?
The employee has the obligation to provide you with the medical documentation that would certify an FMLA claim. Okay. If you have the documentation in a self-administered disability plan that already disables that employee, the FMLA, if it went to the Department of Labor, it is likely that the employee would prevail in you as an employer do have the documentation that you needed in a continuous FMLA claim to support that FMLA job protection if, in fact, the employee was eligible for. If there was no medical documentation to support the disability claim as a whole, the employee has 15 days to perfect their FMLA claim. If there's not medical documentation within 15 days, you can deny that claim. If the information is incomplete, You can communicate that back to the employee, and they have 7 days to perfect their claim. And if that documentation isn't received within 7 days, that claim can be denied.
Okay, great. Thank you, Tim. Did anyone else have any questions for Tim at this time? Okay, and it looks like the questions box stopped blinking. So again, feel free to jump in if you do have a question. You're welcome to either verbalize it or you can type it in the questions box right there on the screen. While we're waiting to see if anyone has any questions, we'll just go ahead and start wrapping it up. So I wanted to thank you, Tim, for presenting today. We appreciate all the great information. Thank you to everyone else who participated. We'd just like to remind you at this time that you are able to download the presentation materials from today's presentation on our website, and they're typically available within about 5 business days on the website. We also do provide the actual recording of the presentation. We post it on our YouTube channel, aisling.university. Okay, so please feel free to check that out. And also, while you're on the website, just take a moment and sign up for next month's webinar, which will be conducted on August 23rd at 11 a.m. That webinar will be utilizing, discussing an Employee Assistance Program, or EAP, at your workplace, the advantages of one, the disadvantages of having one, and things to think about when you're implementing them into your company. Okay, so unless we have any other questions at the moment, I think we'll wrap it up. And again, thank you. And if you think of questions after the fact, please feel free to email me directly, and we'll make sure we get you answered. Okay? All right. Thanks again, Tim. Bye-bye.